Welcome back. Amid the coronavirus pandemic, the Bronx is seeing an alarming fatality rate compared to other boroughs. Joining us to share more about the impact of the borough, we have Dr. Vanessa Salcedo of the Union Community Health Center. We welcome you to the show.
Thank you, Bob. A pleasure to be on the show.
Why are we seeing this in the Bronx? Why is it so high, the fatality rate?
Yes. Unfortunately, it's really devastating for me as a pediatrician, a community doctor, health promotion doctor in the Bronx. These numbers, to me, mean not only numbers, but they actually mean people from our community, my patients, our families, and that's really devastating for me.
Yeah.
But unfortunately, it's not surprising to see these numbers as a health professional. Bob, as you know, the Bronx ranks number 62 out of 62 in health outcomes.
Yeah.
And I know a lot of our viewers know this because you guys talk a lot about this, that what that means is that we have the highest rates of diabetes in all of New York State. We have the highest rates of these chronic diseases that make our community vulnerable. So that's why we're seeing these numbers and these high fatality rates in our community, because we are the most vulnerable community in all of New York State.
So it is the degenerative diseases like diabetes and asthma and things of that nature?
Yeah, so diabetes, asthma, hypertension, COPD, any autoimmune disease like HIV, cancers, these are the unfortunately, the illnesses that our community suffers from in high numbers. And unfortunately, these are the victims from COVID also.
So what can people do in our community to try to head some of that off?
Yes, so, as one of my roles is Director of Wellness and Health Promotion, and health promotion means prevention.
Yes.
So for this brand new virus that we know very limited things on, what we do know is how to prevent it. And we've been trying to be very proactive and really trying to reach our patients and our community to tell them this message that we're hearing over and over again, to stay home to stop the spread. The first thing we really need to understand is to stay home, especially the vulnerable population that we just mentioned.
Yeah.
I know it's hard because, in the Bronx we suffer from, overcrowded, dense populations. Our apartments are small, might be multiple family generations, so it's difficult for us to stay home. But it's really important because community transmission is very high. So what that means is that the virus is everywhere.
Yeah.
And you can't really see it, and things you touch puts you at risk to touching the virus and then transmitting it to yourself or other people. So staying at home is the first and most essential thing to do. If you do have to go out, we recommend for not a vulnerable population person or anybody suffering from these illnesses to help their community members or their family members to get groceries, or somebody in friends and community to get groceries, and really limit that exposure for that person even once a week. Just to limit the exposure, going outside as minimal as possible. So that's number one. That's number one. Stay home. Number two really is if you do go out, you have to cover your face, whether it's with a mask or a scarf, and make sure to cover your nose and your mouth when you do go out to protect yourself and protect others. Because another thing that we're talking about, and we're learning more, since I mentioned this is a new virus, we're learning more that there's what they call asymptomatic carriers. And what that means is that there's people out there that have corona and have zero symptoms.
Yeah.
So you don't know you have the symptoms, but you're spreading it to the vulnerable population in our community. So that's why it's really important for everyone to stay home, because you don't know if you're that person spreading it to others. So, second, if you're a healthy person or you think you don't have corona and you have to go out for something essential, wear a mask. So that's number 2. Yeah, so number 1, stay home. Number 2, wear a mask. Number 3, the most important thing of them all is wash your hands. I know we've heard this enough, and we know we've heard this a lot, but washing your hands is extremely important. It has to be at least 20 seconds. Like I said, if you must go out, wash your hands before you leave the house. Wash your hands when you come back. Wash your hands as much as you can. If you don't have a sink nearby, sanitize. So number 3, wash your hands. So those are the top 3 things our community really needs to focus on and do to help prevent the spread of coronavirus to our vulnerable population.
Doctor, is it airborne? Should you wear goggles? Could you go to some places and they have the shield and everything over their faces?
Yeah, so that is a great question. Like I mentioned, this is a brand new virus. We're learning as we go. We definitely know that it is aerosolized with certain procedures, like intubation when somebody has to be put on the ventilators. So it is in the air for a little while in these really rare occasions. And, so we wear the goggles or the eye shields. Why we do it the most is for 2 reasons. If you touch your eyes, I think at the beginning everybody was talking about rubbing your eyes and not touching your face. And that's why, because the virus enters through your eyes, your nose, and your mouth. Yeah. So if you actually, Bob, you may come up with a 4th recommendation. If you must go out, wear sunglasses or wear your glasses, because that will protect you even more from touching your eyes.
Anybody talking about toilet bowls? Because it enters through the mucous membrane, and people sit down and go to the bathroom. They are talking about toilet bowls. Bob, you do bring up another good thing. So disinfecting your house as much as you can, because you can be that person that maybe doesn't have symptoms, or you might have mild symptoms. Mild symptoms do include diarrhea. So if you've noticed that you've had diarrhea lately and you don't have anything else, or you've heard about you can't smell. Some people are saying they can't smell. Yeah. That might be one of the super mild signs of corona, and you have to think about being extra cautious and really disinfecting. So we do recommend to disinfect the house as much as you can, like high-touch surfaces, which includes doorknobs. We touch doorknobs all the time, toilet handles, sink knobs, and we just say as frequently as you can, as much as people touch them, to really wipe them down. Yeah, and you have to find new ways to be creative, because if you try to go buy alcohol or Lysol, a lot of those things are not on the shelf anymore.
Yep, not on the shelf. There's really great videos on YouTube now, how to make your own hand sanitizer with alcohol, with just regular alcohol and aloe. So that's one way you can make your own hand sanitizer. But Bob, honestly, the best thing to disinfect your hands is washing your hands.
Wash your hands.
That's more effective, because you're rubbing it for 20 seconds with soap and water. And the last thing when it comes to killing the virus is, the good news is that this virus is very fragile. It's not a very strong virus on surfaces. So if you wipe it down with like any regular household item, it's going to die. Yeah. So these are things that we really need to tell the community that, yes, of course, if we have the Lysol spray or the hand sanitizer, that's great, but we do have alternatives that are just as good if you use them correctly and use them frequently.
That's good. Doctor, finally, how are you guys changing the way you do business or the way you see some of your patients at the center?
Yes, like I said, the first thing we did was call our patients to tell them about these recommendations, and the first one is to stay home and to not even see us. We want to talk to our patients over the phone, and if we feel that's something urgent, we'll tell you the next steps. If you need your medicine, we'll deliver them to your house. We'll have pharmacies that we partner with, that we deliver pharmacies to your house, because we really want to make sure that the community is staying home, but we really also want the community to know that we are here for you 24 hours a day. Just because we can't see you doesn't mean we're not here for you. So you could call us 24 hours a day during, whenever, and you can talk to a doctor if you have a simple question or if you're having symptoms. Call a doctor and we'll help you through the next steps.
Yeah. Would you like to give a website or the number?
Yes, of course. Yeah, so you could call Union Community Health Center at 718-220-2020, or you could go on our website to find specific, hours of operation. And all this information on COVID is also on our website. And our website is uchcbronx.org. uchcbronx.org. And one of the last things is that, the great thing is being part of a community health center. The great thing is that we don't turn anybody away. Excellent. So it's really important that, whatever your insurance status is, your immigration status is, that as a community health center, our mission is to serve everyone and not turn anyone away. Because especially in times like this, we really want to help our community not get sick and really stay together and help each other.
Doctor, thank you so much. Dr. Vanessa Salcedo of Union Community Health Center. Thank you so much. We appreciate you, and thank you for your service.
Thank you.
Stay safe. We love you.
We love you too. Take care. I love my community. Bye-bye.
Bye-bye. We'll take a break. I've got more next.